I've made this video to review the details of post-operative care following ear canal surgery so as to optimize healing. The goal is to get your ear canals to heal as quickly as possible to allow a return to full water immersion. The things you want to have at home include cotton balls, which can be gotten at a drugstore or grocery store, pain medication if needed, and then petroleum jelly to coat the cotton balls to keep water out when bathing. At the end of the operation, there's no packing put in the ear, there's antibiotic ointment placed. The skin will also swell somewhat, also blood clot may form and block the hearing. It's typical that the skin edges will bleed somewhat for the first several days, and you may even have blood blocking the hearing as you wake up from anesthesia. The cotton balls there to absorb any bloody drainage can be changed multiple times a day. After several days of no drainage, the cotton can be left out. So the cotton balls you see here are various sizes, basically sit loosely at the outer ear canal. It's recommended after surgery for the first 24 hours you do not drive a car, making personal decisions. Once anesthesia clear out of your system after 24 hours, you can be very active, but keep sweat out of the ear canals with cotton. Get life back to normal, but keep water out of the ears until things are healed. For most patients, this is not painful surgery, and things can be managed with ibuprofen or acetaminophen if needed. The typical ibuprofen dose, 200 to 600 milligrams every 4 to 6 hours. Maximal dose in 24 hours of 3,200 milligrams. With acetaminophen, 325 to 1,000 milligrams every 4 to 6 hours. Total maximal dose in 24 hours of 3,000 milligrams. During healing, it's important to keep water out of the ear canal to minimize chance of infection. You can do this by keeping your head dry, wearing a shower cap, or what's an inexpensive solution is a cotton ball liberally coated with petroleum jelly. The volume of petroleum jelly is about the same as the volume of the cotton ball. It's sort of a messy process. You may want to make several at a time and store them in a baggie, but these can work quite well at keeping the water out. As shown in these ear models, it's just loosely placed to the outside, and that can be effective at keeping water out of the ear canal. If you're having your post-operative care with me, I'll see you weekly to clean material to facilitate rapid healing. If you're having your care elsewhere, I'll give you written instructions to provide for that physician. After you've been cleared for water immersion, if you want to minimize the chance of bone regrowth, using earplugs when you're in water colder than 68 degrees can be helpful. Here are some of the various styles. Some are solid, some allow better hearing, some have leashes, some float. The details of these various ones are gone into in this YouTube video. The goal is to get you back in the lineup with healthy, functioning ears.